Rothman. Without further ado, the time is yours. Dr. Abdullah Rothman will presenting about psychotherapy. Dr. Malik Badri and psychotherapy. Please welcome.
Jazakallah khair. Thank you so much. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. It's an honor to be here with you all. Thank you for the invitation from the International Association of Muslim Psychologists. Thank you to Dr. Bagas and Dr. Hanan. And it's really an honor to be here with all of my colleagues, my esteemed presenters, and these guests. And really, you're all my brothers and sisters because we're all the children of Professor Malik Badri. And so it's an honor to be here this year after his passing and having a year to reflect on the impact that he's had on all of our lives. And it's really an honor to come back together and reconnect with our teacher and our guide. And inshallah, I've been learning a lot in these past, listening to these lectures. And so today, I'm going to add my contribution to this discussion of our teacher by focusing on his approach to psychotherapy specifically. So, what I'm going to talk about is first just understanding the development of his work in the field of psychotherapy and his experiences and how that led to an evolution of his approach to psychotherapy. I think he's written about it a lot in his books, and we all know his theories, but what we oftentimes we're looking at sections of his life. And so I think it's important that we look at what was the culmination of that, to really look at Dr. Malik Badri's approach to psychotherapy towards the end of his life, integrating all these things. So I want to talk about his creativity in therapy and his assertion that this was really important. I'm going to talk about Surat al-Imran, which he often referenced as sort of the model of his approach, a certain ayah, and then spirituality in therapy, really the approach that he was on and embracing towards the end of his life, and then a summary of what that approach looks like, inshallah. So the Professor Malik was really a master therapist, and he was able to become a master because he had been at this for a very long time. He had been working on mastering this craft of therapy for years and years and years. And really, it was a craft to him. It wasn't just learning a science and applying it. It was constantly being engaged in development and the development of his own approach. And so he approached psychotherapy really as both a science and an art. He was extremely methodical about his scientific approach. He was always even when he was dealing with spirituality, he was always very particular about it being well researched and evidenced and following the latest trends. And he was really a pioneer, not only as we know in Islamic psychology, but in the field of therapy in general. And so he gained all of this experience by practicing all over the world. He wasn't a person who stayed in one place, worked with the same people, worked from the same therapeutic standpoint. He was constantly getting different experiences and integrating those experiences in his approach. And so this experience that he got from practicing all over the world in clinics in London and Morocco and Sudan and Saudi and Malaysia, is that he had the opportunity to work in these diverse settings, tested out what works and what works differently with different people, how the context matters, what the circumstances are that change that. And I think obviously we know he was brilliant and he was constantly thinking and pushing the bounds, but I think his his international experience and his diversity of experience really lended to his approach, tools from a lot of different areas, right? So he was constantly pulling on his own experience, and he was always experimenting in the field. So he used his own clients and his own clinical experience in these different places to try different things out. He would come up with new techniques, see what worked here, see what didn't work here, and adapt it in this sort of scientific method, but really this art form of figuring it out. And because of this broad spectrum of experience, he really was a pioneer in adapting a culturally relevant approach to psychotherapy very early on. One of the first people in the field to be understanding that this matters and showing how it matters. So a lot of his early work was his own development within therapy of coming up with new techniques that were outside of the box of Western therapy. And at this point, it was just really the craft of understanding how to work with human beings, much less before he really even came into embracing and being known for the Islamic approach specifically. He was just a brilliant therapist, and constantly innovating and evolving. And so if we look at the evolution of his psychotherapy and his approach, you can look at it in these sort of classifications, and it sort of matches the evolution of therapy in the field. And that's not because he was following the trends. He was really a trend setter. He was constantly, he would read every journal that was ever out there, all of the clinical innovations in the field. He was following them and he was innovating and developing them. And so when it moved from analytical to behavioral, he was not only doing this behavioral therapy, he was pulling directly from our early Muslim scholars to learn these creative behavioral techniques and implementing them in his own practice. And then in the movement to cognitive therapy, also pulling on the works of the early Muslim scholars, but being really inventive in his own way about figuring out what works. And towards really all along, he was conscious of the spiritual reality and being aware of how Islam and his own belief impacted. But as he became more mature and integrating all these experiences, spirituality became to be more present in his approach to psychotherapy. And we'll talk about that a little bit when in terms of what his approach was. But always from the beginning, what was really important to his approach and what he always taught his students was to be creative. And he was against this notion of having one style of therapy that is your theoretical orientation and you stick to that. He said we need to be creative, we need to not be stuck in a certain way. And he would assert that it's a big mistake for us, particularly as Muslims, to mimic the field of medicine in this way, in this approach to therapy. And so he would not restrict his sessions to 50 minutes like we do in the Western therapeutic model. He would assert that it's important to spend as much time as necessary for this particular client. He was thinking outside of the bounds and outside of the walls of the box that had been created, which was revolutionary for his time. And in some ways, it's still revolutionary. And he also didn't restrict his therapy to the walls of a clinic. He would be in the community with people. He would be doing, he would take people into the community and he would have the relationship with them like their brother in Islam, not this sort of false professional distance. It's not to mean that he didn't honor and understand ethics and what that creates, but he was honoring that there is a framework within the cultural Islamic, cultural Muslim communities that where this brother-sister relationship was really fundamental to being able to help people and have them be open. And so he talked about not being restricted to the rituals of psychotherapy, and not to sort of create this distance between the therapist and the client, where the therapist is the one who knows what is right for the client, and there's this authoritative approach. He was always breaking that wall down and really recognizing that we're two human beings and that there is a place for giving advice and counseling as another human being or a sister or a brother. And so it's this real human approach. Sorry, it looks like someone took over the screen. Huh? You see my screen again?
Yeah.
Yes, yes.
Okay. This was a really, really important aspect of his therapy, and it gave rise to where he took it in terms of being able to innovate and develop a really unique Islamic spiritual approach to psychotherapy, because he was innovating this and adapting and creating, and it wasn't just an approach. It was a constant evolution. And so part of that, where his approach to psychotherapy developed, and if we could look at something that really became, I would say, a framework for him that he often referenced, was based on this ayah in Surah Al-Imran. And he spoke about how this ayah has all of these four elements. There's four elements in here that guide us to how to be a counselor, how to be a therapist. And so if we look at this a little bit more closely, it was from Allah's mercy that you were gentle with them. So this is Allah talking about the Prophet ﷺ and how he was with the companions. Had you been rough and hard-hearted, they would surely have scattered away from you or left you. So pass over their faults, ask for Allah's forgiveness for them, and consult them in matters of importance. And when you are resolved on a course of action, place your trust in Allah. Tawakkal ala Allah. Surely Allah loves those who put their trust in him. And so these four elements of being gentle, he would use the word lenient, being lenient with clients. So it's not this authoritativeness, and it's being merciful. Mercy was the first and foremost approach in his way of psychotherapy, of allowing the person to feel relaxed, to feel comfortable, to feel as if they are in safe hands, and that it was based on love. And this, what he would say is this idea of passing over their faults is part of this mercy, right? So and oftentimes in traditional therapy, there's this zooming focus on faults at the very beginning without there being mercy, and it alienates the client. And so he was saying you have to build it on this merciful lenience, and that you accept them. But it's not, he made this distinction that it's not to say that you're saying everything's okay, that everything's fine, and that you're just sort of accepting them, whatever they say. He would criticize the type of therapy where sort of the client just says whatever they want, and the therapist is basically just there listening. He would say, he calls it therapy, right? The client is just talking away, and the therapist is just taking notes and barely ever saying anything, never guiding them. So it's not like he was saying be passive, but he was saying to be merciful and gentle and being accepting, but being discerning. And so it's not about, he would distinguish between a notion of unconditional positive regard. So the positive regard part was unconditional, but not without advising the client towards what's better. You don't just accept everything that they're doing, but being merciful in giving them advice. And this this notion of forgiving, as these things will come up, you're helping them embody and understand the notion of forgiveness of Allah. And then this word consult, this idea of consulting them, meaning that there is it's not telling them, it's not saying what to do, but it's this partnership. What can we work out that's best for you in this moment, and being creative about how to consult them. And then recognizing that when that decision is made, or when a course of action is made, a treatment plan through that consultation, to still understand that at the very core of this, it is in Allah's hands. Allah is the one who is going to ultimately heal the person, and that the two people, the therapist and the client, are in the fold of or in the hands of Allah. And this was really, really important. So I want to give you some of Professor Malik's words himself on this, just to show you a short clip on this topic.
Here is the issue, to bring in the spiritual. If you cannot do it openly, do it within your heart. If you feel the patient cannot take it, to say to him, please let us make dua yourself in your heart. Ya Allah, astaghfir, save this person, give him strength. You are using me as a tool in helping him. Give me tawfiq in this. This is very important indeed. Because whatever we do, at the final analysis, it is Allah subhanahu wa ta'ala who does it. It is not we.
So this point about stressing that it is Allah subhanahu wa ta'ala that is doing it, and it's not the technique, it's not your training, it's not your position as a therapist, but it is bringing this spiritual element into the therapy in a very real and profound way. And so he was saying that as a therapist, and in his approach to psychotherapy was grounded in being very clear about what this is about, and that Allah is present in the therapeutic alliance, even if you don't mention it. So even if it's not appropriate, like let's say you're in a hospital, in a secular setting, and you can't make dua, or maybe it's not appropriate for this particular client, that if you can, you should bring this in. You should make dua in session. He often referenced his colleague. He used to tell this story about his colleague John Sullivan from the US, who was a convert Muslim therapist, and that he was so touched by that he shared with him that he would make 2 rakahs before each session, and then at the beginning of every session he would make dua that Allah is there present in the therapy, and that Allah facilitates whatever's best for the client. And so Professor Malik said, this is really how we should be working. This is what we should be bringing into the therapy, and not be shy about it. But if we can't do that, as he's saying, then we have to still approach it from this way of being grounded in the spiritual reality of what's happening here. And then you can use your training, you can use the science of psychology, you can use the therapeutic techniques that you've learned to facilitate Allah, to facilitate you being a servant of Allah, serving this person before you. And so he was talking about bringing Allah into therapy. And this is something that a lot of people feel is very controversial, or feel like they don't often feel like there's room to bring this in. But I don't know if you can see the slide advanced. It looks like it's not showing. There we go. Thank you.
Yes, we can.
Okay.
Yeah.
So when bringing the spiritual into therapy was something that he spoke more and more about towards the and really stressing this notion that Allah is the one that's healing. And not only that, but that a lot of his work, he would say, he found that it was correcting people's image of Allah, because people have such a damaged relationship with Allah because of how they have been taught. A lot of people have been oriented to Allah as this source of punishment and severity, and this creates this relationship that is damaged. And he said that this was at the core of a lot of psychological issues. This is often what he felt, what he was healing or undoing the knots of, was people's image of Allah. And so a lot of the work that he would say is bringing Allah into therapy is bringing it into your heart, but also really almost correcting people's aqidah of their relationship to who Allah is, and how that affects their own relationship to their problems, their relationship to the people in their life, and their relationship to Allah in their life. I'm gonna play another and me, and he says it better.
It is the spiritual dimension. Don't believe in yourself as a Muslim. If within your heart you ask Allah, please help me to help this person, Allah will use you as a method to help this person. We as Muslims should look at the behavior of our behavior. I remember the first time I read Al-Ghazali and that about this pig and lion. Then I begin to look at my own self. If I do something, hey, where is the lion in your
So here, hey, Professor Malik was really keen on that it's not just, again, the notion of bringing Allah and this awareness of the spiritual for the client has to involve the same for the therapist, and that the therapist has to be working on themselves, doing their own work internally in order to be a servant of Allah. And that he talked about this sacred relationship. It's an honor that Allah has chosen you to help this person before you, and that you should be honoring that by being exemplifying the example of the Prophet sallallahu alaihi wasallam as an example for how to be doing therapy. And so he's talked about how the Prophet was the perfect counselor, and that in our own work on our own heart, that we should be emulating the character of the Prophet, healing our own heart to shine this perfected character that the Prophet showed us. And that if we do that, we see in this character of the Prophet all the essential qualities of how a therapist should be in psychotherapeutic relationship. And so use the example of being gentle and lenient. This is what the Quran was referencing in this Surah Al-Imran. Had you not been gentle, had you been hard-hearted, they would have left you. And so it is this example of how the Prophet was so merciful, and how that's a foundation for having people be able to work through their things and be able to help them. And he referenced how the Prophet ﷺ would fully turn to somebody when he was listening to them and make them feel like they were the only person in the world. And so this level of attention and attentiveness and honoring the client is really important. And he said that we should, as therapists, be asking ourselves, if the Prophet was in your place, what would he do? Really trying to connect with the prophetic example and the stories in the seerah as our model of therapy. So to talk a bit about how he then moved, he then moved into more and more into this Islamically grounded and oriented way of working, where he was less and less concerned about having to fit within the Western paradigm and really understanding more how this spiritual approach is what people need for really helping them. And that the core of the work is looking at the person based on what he had learned from all of these early Muslim scholars and really assessing, taking that conceptualization of the soul and implementing it in things like assessment and treatment. And so his general sort of way of assessing when a client would come is looking at where are they stuck. So what is the presenting problem? But he would ask, just like he mentioned in this video, where is the lion and the pig? He'd be looking for these muhlikat, these destroyers of character, the things that come up. Are they angry? Are they focused on greed and envy? What is the thing that's inflamed? And then looking at, well, where is Shaitan in this? Because you remember his secular training, and at the time, Freudian therapy was all about the ego and the human being, and there was no to this assessment of what's going on and being actually honoring that reality. But then not just looking at the negatives, he would always balance it with what does the qualities of this person, what strengths does this person have that we can build upon? And then ultimately, like I said, he would spend a great deal of time on helping the person heal and correct their relationship with Allah, because oftentimes this is where a lot of the inner trauma is. Either there is, from trauma as a result, people's relationship with Allah gets damaged, and this is at the heart of a lot of the psychological issues. And then with treatment, he was, again, being creative and innovative and experiential. His approach to treatment was not just talk therapy. He was constantly thinking innovatively, taking people out, giving people experiences, whether it was to flooding, using his knowledge of lots of different areas and even popular culture and literature to help find out what makes sense to the person, was guided imagery in his therapeutic approach. And so this was basically using tafakkur, the practice of Islamic contemplation, and integrating it in helping the person walk through within the therapeutic encounter. And so what he would do is he would discover a client's positive experience in nature. So he would have them recall some time when they felt at peace, specifically in nature, following the notion of that we look to Allah's creation, and then that points to Allah, the person to Allah. And then he would build on and elongate that experience of contentment by helping them. He would have them close their eyes and do this guided imagery to help the person imagine the oceans. What is it that you're feeling? He would really walk them through this. And then as they're feeling this state of contentment, he would start to bring the Rimina and training them to make that connection to Allah and connecting the positive experience with this love of Allah, this positive experience for Allah. Because he said in this correction of people's relationship with Allah was that they were removed from the love. Love was such an important quality at the core of what needs to be healed in a lot of the presenting problems. And so it's on a deep level. He was really working on a level of the soul, not just cognitions. He was a master at cognitive behavioral therapy, and he used that all the time, but he was also, especially towards the end, really working at a deep level with the soul and really healing hearts. And so to summarize, I would say if I were to come up with 6 sort of main things based on what we have been talking about that really are quintessential to Professor Malik's approach to psychotherapy, it would be being gentle or lenient with the client. So this is this mercy. And it's important that that comes first. He always talked about the mercy being first, the foundation. And then being creative, not being stuck into one way of working, but really thinking outside of the box. This was a quintessential aspect of his approach to psychotherapy. Looking to the Prophet ﷺ as an example. And he spoke more and more about that towards the end. And this is why in his last book, The Emotion of the Prophets, he intended to write that about the emotion of the Prophet Muhammad ﷺ, and wanted that to be the second one if he got to it. But he was saying more and more that we need to look to the Prophet. And then ensuring that the therapist does their own work, that we have to, as therapists, look internally and clean our own hearts, because this is how Allah can come into the therapy. And then bringing the spiritual into therapy, not being afraid to stand firm in your Islam and use, whether it's reminding the person of being with Allah or integrating these practices of tafakkur in therapy. And then ultimately what this is all held in is remembering that Allah subhanahu wa ta'ala is the healer, and that the therapist and the client are really parallel. They're human beings, they're fellow Muslims reflecting with one another, being mirrors to one another, but that it is Allah that is doing the work of healing. Thank you so much, and I look forward to hearing from my colleagues, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much, brother. That such an inspirational speech that remind us to what Prof. Malik Badri always taught us about connecting us as a therapist and also the client to Allah. And also please thank you for reminding us about Ali Imran 159 verses 159. Thank you very much. And we will listen to the second speaker.